It's Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. Today I have an email from Arlene who says, "Hi Patrick, I looked over your website intensivcarehotline.com and I wasn't sure if our needs were a good fit for your service. What I'm really interested in is a review of all the medical records of my husband's hospital stay, starting from the procedure he had on April the 16th through his current situation. As time is of the essence, I wondered if that was a service you could offer and at what price." Basically, as we discussed over the phone, he was a reasonably healthy man who went in for an elective hybrid ablation procedure and is now comatose owing to hypoxia incurred after a cardiac arrest. I want to know what happened. This was to be a minimum risk procedure. Thus far, I have been able to avoid moving him to an LTAC, and they have agreed to another MRI and another neurologist consultation. Can you help us? Of course, Arlene, we can help you with that. I know we initially spoke on the phone and now you're reaching out with an email again, which is great. Absolutely, this is something we can do. Now, an ablation is usually done for AF atrial fibrillation, and it's sort of a small procedure that works on the conduction system of the heart and trying to bring it back in line when someone is in AF or atrial fibrillation, which is an irregular heart rhythm. So it is a routine procedure. I've seen it many times when I worked in critical care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years. So I have seen it many times, and it is a straightforward procedure, or it should be a straightforward procedure. So we can absolutely find out in the review of the medical record what went wrong. Now, how much do we charge for this? It really depends on the volume of the records. You know, sometimes we get asked to review months worth of ICU records or weeks. You know, that's different charge compared to if it's only a few days. So it depends on the volume, but it also depends on the questions that you have when we review the medical records. So I hope that answers your question. It's good that you managed to keep him out of LTAC. Absolutely keep doing that. And there's nothing stopping you. No one can force you to move to an LTAC from ICU if your family member is on a ventilator with a trach. So, you know, it's just a case of standing your ground and not agreeing to things that you don't give consent to. So I hope that answers your question. With intensivcarehotline.com, I've been consulting and advocating for families in intensive care with my team here at intensivcarehotline.com since 2013. And we have been saving many lives as part of our consulting and advocacy. And you can verify that on our testimonial section at intensivcarehotline.com or by watching some of our podcasts on our podcast section where we have done client interviews. And that's why we also created a membership for families of critically ill patients in intensive care here at intensivcarehotline.com, because we want to help as many families in intensive care as possible. And you can become a member if you go to intensivcarehotline.com and you click on the membership link, or you go to intensivcaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, sharing all my 25 years of critical care nursing experience with you, so that you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. Also, I do one-on-one consulting and advocacy for families in intensive care over the phone, Zoom, WhatsApp, Skype, whichever medium works best for you. And I talk to you and your families directly. And I handhold you through this process when you have a loved one in intensive care, through these once-in-a-lifetime situation that you can't afford to get wrong. I also talk to doctors and nurses directly on your behalf, and I also represent you in family meetings with intensive care teams. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care, so that once again, you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. We also do medical record reviews in real time so that you can get that crucial second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website or send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families of critically ill patients in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you go if you are a subscriber to my YouTube channel, or if you're a subscriber to our email newsletter at intensivecarehotline.com, go and subscribe there. And if you want your video done quickly, because I have videos, I have emails sitting in my email inbox from last year that I'm still answering here. If you want to get your video done quickly and you want to have your questions answered quickly, leave a small donation here at the YouTube super chat button, and I will get to your video very quickly and get your questions answered very quickly. And if you are wanting to leave a small donation to help us grow the channel and help us to make as much content for families in intensive care and help as many families in intensive care all around the world, leave a donation. Everything helps. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.